Hi, I'm Dr. Rheure Lopes, and I'm a research associate at the BAGF Center of Research Excellence here at the University of Glasgow. I started to think about becoming a scientist when I was very young and starting my undergrad in Brazil. There are many cases of hypertension in my family, and despite the advances in how to treat these patients, many members of my family are still having consequences of hypertension, which proves that there is still a lot to be explored in the field of hypertension and cardiovascular diseases. And within that in mind, I decided to do my PhD and master degrees on cardiovascular pharmacology. Nowadays, we know that the mechanisms that causes hypertension are very complex and very often are associated with hypercontractility of vessels, which are followed by changes in the structure of the vessels, which make these vessels very stiff. Calcium, which is very important to our health, regulates how your vessels work. What we see in hypertension is that the vasculature becomes sensitive to calcium and contraction. This increased sensitivity to calcium leads to a dysfunctional vessel. In my research, I'm interested in some specific proteins, called calcium channels, that are important to regulation of calcium entrance and exit in vascular cells. Moreover, I'm also studying the relationship between these channels and mechanisms that regulate calcium with changes in levels of sodium or salt. This is because a high salt diet is deleterious to our cardiovascular health. Well, from my work, I want to identify new therapeutic targets to treat hypertension and improve the quality of patients suffering from this silent killer.